Now, the Ministry of Education has published guidelines on health and safety protocols for the reopening of basic education institutions. The guidelines spell out measures all basic educational institutions should put in place before they are allowed to reopen schools. The regulations demand that all basic educational institutions be involved in ensuring learning continues for all Kenyans despite the interruptions occasioned by the COVID-19 pandemic.
The government closed all learning institutions from 15th of March 2020 to curb the spread of the coronavirus. The pandemic has disrupted learning for over 18 million learners and trainees in Kenya, posing a threat to the attainment of Sustainable Development Goal number 4 on access to quality, equitable and inclusive education and training. To address the COVID-19 pandemic, the Ministry of Education developed a COVID-19 response and recovery plan whose aim is to guide on modalities of provision of accessible, quality, equitable and inclusive education and training to all Kenyans during and after the pandemic. The regulations demand that prior to the reopening of schools, educational institutions develop policies and procedures suitable in their own environment to enable smooth reopening of the institutions and provide budget to institute a safe and protective learning environment by putting in place all health protocols required in the fight against COVID-19. In preparation for reopening of educational institutions, heads of institutions are required to build the capacity of institutional staff, learners, boards of management, and parents on the management of COVID-19, ensure adequate clean running water and sanitation facilities in the institution, develop awareness messages, and enlighten learners, teachers, non-teaching staff, parents, and entire institution's community on key COVID-19 prevention. During and after reopening of institutions, school heads are to ensure revision of institution rules and regulations and a daily routine to be responsive to the changes occasioned by the COVID-19 pandemic. Ensure institutions reorganize respective activities to ensure a social distance of at least 1 meter in all aspects of the institution. Maintain updated biodata of all learners and contact numbers and home addresses of the parents, guardians, caregivers for ease of management of emergencies, and keep parents and guardians informed of the physical and behavioral changes expected and to be implemented in the schools and colleges. The head teachers are demanded to restrict entrance of visitors in the institution, and all institution events such as career and motivation days are cancelled until further notice. All educational institutions should have adequate toilets which are properly maintained to prevent spread of diseases. Institutional food handlers and cleaners will be required to have personal protective equipment, including gloves, apron, and face masks to promote basic health and hygiene. Learners should maintain at least 1 meter distance from others while waiting to board vehicles, and the ground should be clearly marked. In respect to co-curricular activities protocols, fields shall be appropriately marked to ensure learners play different games that avoid touching or holding. The institution management will be required to ensure there is a qualified nurse in charge or have arrangements with local health centers to manage learners' health-related issues and ensure institutions' clinics are equipped with emergency medical supplies to assist learners and staff in the event of COVID-19 outbreaks. Purity Museo, Channel 1 News.